Hi, my name is Shannon Gidley. I'm an MD candidate in the class of 2023 at IU School of Medicine, and I'm talking about alternatives to radial arterial line placement. I have no financial disclosures. So to start off, an overview of why we use arterial lines. They're most beneficial for continuous blood pressure monitoring and easy access for drawing labs, and they're most commonly placed in the radial artery. So what if you had difficulty placing one on a patient, for example, if their radial artery was too small or if they had inadequate collateral blood flow? First, you can consider placement at a different site, such as brachial or dorsalis pedis, or femoral or axillary arteries. Some of the site-specific complications for these sites can be seen here on the right. Also, you could consider using a device that measures blood pressure continuously, non-invasively. Two such devices I looked at are the ClearSight device, which uses a finger cuff with a volume clamp that compresses the arteries in the finger to a constant volume and measures and reports back the pressures in the cuff, or the T-line system, which uses arterial tonometry, sensing the pressure of the radial artery through the skin at the wrist. I looked at a few studies on some of these devices, and the first one I looked at found that the ClearSight reduced intraoperative hypotension compared to standard blood pressure cuff alone. The second one I looked at used ClearSight as well and found that the continuous non-invasive blood pressure monitoring with ClearSight contributed to intraoperative hemodynamic stability. The last study I looked at compared the T-line device to arterial catheters and found that non-invasive measurements were in an acceptable range. While these devices may be accurate, the current clinical utility is unclear and there needs to be more research done, but they may be able to be used in low or intermediate risk procedures in the future. Here are my references, and thank you for listening.